everyone, I am Dr. Kavita Rao. I am the Cornea, Cataract and Refractive Surgeon at Aditya Jyot Eye Hospital, a unit of Dr. Agarwals Eye Hospital at Mumbai. I am here to talk to you today about endothelial corneal transplantation. Endothelial corneal transplantation is a sutureless type of corneal transplantation. Let's begin with telling you what is the endothelium. Endothelium is the innermost layer of the cornea, which is the front clear lens of your eye. What the endothelium does is it pumps water out of the cornea and helps in maintaining the clarity of the cornea. Essentially, a good healthy endothelium is important to keep your cornea transparent. Now you may ask, why does it need to be replaced? In conditions where the patient may have a genetic disorder like Fuchs endothelial dystrophy, or it may be damaged because of a poorly done cataract surgery, a damaged endothelium may need to be replaced. Endothelial cells are like brain or neural tissue which do not get regenerated and do not grow back. Hence, they need to be replaced. Now, in earlier days, whenever the endothelium was damaged and the cornea became opaque or cloudy, the entire cornea was changed. A full thickness corneal transplantation was done, which needed sutures, which required a longer recovery time, which also needed multiple visits of the patient, and also a higher risk of endothelial graft rejection. That is why the advent of replacing only the endothelium. Now, the endothelial transplantation are of three types. One is the DSEK, second is the DMEK, and the third is the PDEK. What is the difference between all three? Essentially, they are very similar, but however, in DSEK, along with the endothelium, some amount of the donor stroma is also implanted into the cornea, whereas in PDEK and DMEK, it's a pure endothelial transplantation where only the endothelium is transplanted. Now, what are the advantages of an endothelial transplantation over a conventional penetrating keratoplasty? First and foremost, the shape of the cornea is maintained, the integrity of the cornea is maintained because we are not cutting the cornea, we are only replacing the inner layer. Secondly, there are no sutures, so faster recovery. Thirdly, there is lesser risk of endothelial rejection. Much faster visual recovery to the patient is the fourth advantage. Now, what do you expect when the surgery is done? How fast will your visual recovery be? The process of surgery is such that on the day of surgery in the morning you come, medications are put into your eye, you're taken up for surgery. At that point, the surgeon makes a very small incision and removes your damaged endothelium and then folds the donor healthy endothelium and puts it into your eye. The surgeon uses an air bubble to push up this healthy endothelium onto your own cornea. Now this healthy endothelium which has been put sticks to your cornea immediately with the help of the air bubble, but you may expect to remain in the supine position because the air bubble takes around 24 to 48 hours to clear from your eye. So because of the bubble in the eye, you will not have any clear vision for the first 2 to 3 days, and that is normal. Now, when does visual recovery start? Visual recovery essentially starts once the air bubble starts clearing from the eye, which can take anything between 2 days to about a week. Now, the advantage again with DSEK and DMEK is that the visual recovery is very quick and most patients get great vision by the end of the second post-operative week and definitely at the end of 1 month. Now, what are the complications of this surgery? What can go wrong? Sometimes, occasionally, in spite of the best surgeon, who doing your surgery, there is a 5% chance that the donor disc or the donor endothelium tissue may dislocate. If that happens, there's nothing to worry. The surgeon will just take you back into the OR, put some more air into the eye and stick your donor endothelium back onto your cornea, and you can have a great vision. But if in spite of having no sutures in the eye, you still need to be on regular follow-up with your doctor and ensure that the donor endothelium which has been transplanted stays healthy. That's all for now, friends, and have a great day. Thank you.